Thanks for having me on, Duke.
Boy, I tell you, I watched that entire hearing you had on the topic of abortion. When you're
Yeah.
trying to get these women to admit, right, that what they're doing is what they're doing. I've never met a group of women so adamant about the morality of what they're doing and so unwilling to own it. Tell us a little bit about how this hearing came to be.
Sure. Well, this is the Democrats. They got to call all the witnesses except for one. We had a brilliant woman who was on the pro-life side, and then there were like four pro-abortion witnesses. The Democrats thought this would go well for them, but and the Republicans, we were warned, hey, maybe you should just direct they were telling the Republicans, the Republican advisors were saying, maybe just direct your questions to the pro-life witness, and maybe don't confront these other witnesses because they might make you look bad. Yeah, and one of these women was an abortion doctor. Okay, she was unapologetic, unashamed, one of the most radical, abortionists you've ever seen. And I leaned to my colleague on the left and my colleague on the right, and I turned around and talked to the staff behind me, and I said, I'm going to talk to her. I want answers from her.
Dr. McNicholas, what's the medical consensus for age of viability of a fetus?
I appreciate the question. So viability is a complicated medical construct. There is no particular gestational age. There are some pregnancies in which a fetus will never be viable. There are a number of different factors that we think about when we're considering if a pregnancy is or isn't viable.
So is there a legal consensus on the age of viability?
Not to my understanding, but I'm a physician, not a lawyer.
What's, in your 10 years as a doctor, how many abortions have you performed?
So I provide a variety of different services, and
I'm not asking about the other services. How many
Right.
abortions have you performed?
And so I started by asking her how many abortions she's performed. And she started to tell me about the other medical procedures she performed. I said, I'm not asking that. How many abortions?
So I can't tell you how many hysterectomies I've done, and I can't tell you how many abortions I've done. I've had a long career of taking care of people for a variety of
So
things.
you manage a facility. Can you tell me, or you're the medical overseer of that?
She basically had lost track. Like she couldn't tell me how many abortions. But after we established that she was an abortion doctor, and it's hard to use those two terms together because the Hippocratic Oath says that you're not going to harm people. And so it's hard for me to say the two words abortion doctor, but, she established herself as one. She runs the clinic in Missouri.
Can you tell me how many abortions the facility in Missouri performs each week?
I can tell you, and I believe it's publicly available, so I can give you a rough estimate of how many abortions we perform per year, which
what's
is,
that?
I think, roughly around 3,000.
Her every week, and she said 3,000 a year. I asked her how they dispose of the remains. She basically skirted that question.
How do you dispose of 3,000 fetuses every year?
So Missouri has a state law that requires that we send all of the remains of pregnancy to pathology.
What's the latest term abortion that you've performed, like gestation period in weeks?
So my practice includes the provision of abortion up until the point of viability. And again, we already had a discussion about viability not being a...
So just give me the number in weeks then.
I don't know.
You don't remember the number of weeks?
That's correct. So
what about size of the unborn baby? Do you know the largest baby that you've aborted?
I'm not sure how I would even quantify that.
She acted like she didn't understand what gestation period in weeks means or the weight of a baby. And so I just asked her straight up, what's the oldest baby you've aborted? And so I finally asked her, well, how many fetuses? I used her language in the beginning. How many fetuses do you abort there every year?
If I use the word fetus, do you know, you have no idea the age or gestation period of the fetuses that you're aborting?
So again, as I said, my practice includes abortion care through the point of viability. And as we previously discussed, that could be
Let me put it this way.
Point.
So what I wanted to know was if I wanted her to define viability, and she wouldn't do it. She skirted the question.
Yes.
Is there any point of gestation beyond which you personally would not abort a fetus?
You know, medicine is not black and white. I recognize, in my 10 years of practice informs this opinion, that pregnancy can be really complicated. And given that there are pregnancies for which a fetus may never be viable, I think it's really important that we allow physicians and patients to have every medical resource to make decisions that are appropriate for them and their health.
In the absence of a law preventing it, would you abort a viable fetus?
But I just got to the heart of the matter, and I said, I said, in the absence of a law preventing you from aborting a viable fetus, would you abort a viable fetus? And she wouldn't answer the question. It was so painful for me to talk to her about this in these terms. You know, I was using her medical terms, her cold medical terms, hoping to get an answer from her, and she just danced around it the whole time.
Again, every patient is different, and I can't make any.
I'm just asking about a viable fetus. If the law didn't prevent it, would you consider it a limitation morally for you to abort a viable fetus?
So I think you're forgetting that there are a number of reasons that go into patient's choice.
I thought you, at your clinic, does it matter what the reason is for the abortion?
At my clinic, I trust that women have a valid reason. Every reason that they have is valid.
Okay, so given that you think that every reason is valid, would you abort a viable fetus if there was not a law preventing it?
Again, given that the reality for people choosing abortion is that there are many reasons, there isn't a single thing that defines somebody's choice. It is a reflection of their...
You seem to have a hard time saying this. This tells me you have a heart, or at least you know that people watching this have a heart, and they would be concerned if you would just admit, which you won't admit here, that you would abort a viable fetus for any reason if the law did not prevent it.
Mr. Massey, abortion is moral, it is important, it is health care, and I support people being the experts in their own lives and making decisions for themselves.
It gives me some hope that you here understand that people do not support you when you say, or if you would say that you would abort a viable fetus for any reason. But given what you told us in your opening statement and knowing what you've said, we know that you would. But it does give me hope that you still know in your heart that's wrong. Mrs. Stuckey.
I'm not sure. Can I respond to that really quickly?
If you would answer my question, you could, but you won't. So I'm going to use my remaining time asking Mrs. Stuckey, should any reason be a good reason for having an abortion?
Absolutely not. It's a child. It's a life inside the womb from the moment of conception onward. And I'm very troubled by how flippantly she said that there are 3,000 abortions performed every year of defenseless human beings, and the remark that abortion is moral.
Time has expired. I reckon
that kind of logic driving my lifestyle.
No, the time has expired. I recognize.
Gave the others over 2 minutes over, Mr. Chairman. Mr. Chairman, we need to be fair on both sides of the aisle, please, sir.
You want to finish your.
Please, I'd like for.
No, finish your answer. Go ahead.
I don't quite understand the logic of saying that killing a child inside the womb for any reason whatsoever is moral, is healthcare. In what other situation, besides when a child is defenseless in the womb, do we call killing someone healthcare? Do we call killing someone moral? Can anyone on the pro-abortion side tell me a situation outside of a defenseless child inside the womb in which it is morally justifiable to kill someone simply because they're not wanted? That's the answer, or that's the answer that I would like. That's the question that I have. I unfortunately don't think anyone's able to answer it for me.
Well, of course, they stuffed that room with pro-abortion folks, right? I couldn't see. I'm sure there may have been a couple in the room who were pro-life, but this is Washington, D.C. I mean, 96% of the people here are Democrats, and this was their hearing. This was going to be their day. And I felt like, as I was asking this doctor the questions and exposing her depravity, and her complete lack of morality. And then as Ms. Stuckey chimed in and drove the point home, I didn't see any smiles. I didn't see any laughing. And this is among the people who want abortion for any reason up to any age. I think they were sitting there thinking, this is not going well for us, because he's just made not just a moral argument, but a logical argument for why this is wrong. And I just felt like the whole room wanted to take a deep breath when that questioning was over, because frankly, it was outside of my comfort zone to do it.
Did you get any pushback afterwards? Obviously, it didn't go the way they wanted. They were not counting on that. They expected you to simply let Allie talk and not add anything else. What kind of reaction did you get after it was over?
Nobody wanted to debate me. Imagine that. Like, nobody came and said, I want to follow up on that question. They were so glad when my time was up. And so I got a lot of positive feedback, frankly, on the internet. When I put it on Twitter and Facebook, usually you get a lot of haters. 50% of the comments are going to be the resist movement. Those people didn't show up for work that day. In other words, on my Facebook page to hate. They had nothing to come back at that video with. And so we scored some points for the unborn and those that can't protect themselves in that hearing, and that upset the Democrats. They were planning for us to just roll over.
It was wonderful to see. And if I may say, exactly what Washington, D.C. needs is more moral arguments. Please, sir, keep making them. Congressman Tom Massey from Kentucky, thank you so much for your work on this issue, standing up for life.
Thank you, dude.